Welcome to our comprehensive guide on gingival curettage. In this video, we'll explore what gingival curettage is, why it's performed, its various types, clinical indications, procedural steps, and the healing process. Gingival curettage is a dental procedure aimed at treating diseased gum tissue. Understanding this technique is essential for dental professionals and anyone interested in oral health. We'll start by defining the procedure and its rationale, then move through the types and indications, before detailing the steps and expected healing timeline. Let's begin by clarifying what gingival curettage actually involves. Gingival curettage is defined as the scraping of the inner diseased wall of the gingiva to remove ulcerated or hyperplastic epithelium and damaged connective tissue, all the way down to the intact gingival corium. The main purpose is to eliminate chronic inflammatory granulation tissue, which often contains bacteria, calculus, and proliferative cells. By removing these tissues, the procedure promotes resolution of inflammation and allows for healthy re-epithelialization. This foundational step sets the stage for improved oral health and recovery. The rationale behind gingival curettage is rooted in its ability to remove chronic inflammatory granulation tissue. This tissue harbors bacteria, calculus, and cellular proliferations, all of which contribute to ongoing inflammation. By scraping away these harmful elements, the procedure helps resolve inflammation and encourages the formation of new, healthy epithelial tissue. This process is crucial for restoring the integrity of the gingiva and preventing further periodontal issues. Gingival curettage can be classified into several types based on the technique and area treated. The main types include gingival curettage, which involves lateral soft tissue removal, subgingival curettage, performed apical to the epithelial attachment, inadvertent curettage, which occurs unintentionally during scaling or root planning, and other modalities such as surgical, chemical, ultrasonic, and laser curettage. Each type has its specific indications and procedural nuances, which we'll explore further. Gingival curettage specifically refers to the removal of lateral soft tissue from the gingiva. This technique is often used to treat superficial diseased tissue and is typically performed with a curette. The goal is to remove the affected tissue while preserving as much healthy gingiva as possible. This method is particularly useful in cases where inflammation is localized and does not extend deeply into the periodontal pocket. Subgingival curettage is performed apical to the epithelial attachment, targeting deeper tissues within the periodontal pocket. This technique involves a scooping motion with the curette, starting from the bottom of the pocket and moving toward the alveolar crest. Subgingival curettage is especially beneficial for treating deeper pockets where inflammation and tissue damage extend below the gum line. Inadvertent curettage occurs unintentionally during procedures like scaling or root planning. While not a planned intervention, it can still result in the removal of diseased tissue. However, because it is not controlled, the extent and effectiveness may vary. Dental professionals should be aware of this possibility and monitor tissue response during routine periodontal therapy. Beyond traditional mechanical curettage, other modalities include surgical, chemical, ultrasonic, and laser techniques. Surgical curettage involves more extensive tissue removal. Chemical curettage uses caustic agents like phenol. Ultrasonic curettage disrupts tissue and alters fibroblast nuclei. And laser curettage offers bactericidal and detoxification benefits, especially for inaccessible pockets. Each modality has unique advantages and limitations, which should be considered based on patient needs. Gingival curettage is indicated in several clinical scenarios. It is particularly useful for treating infrabony pockets where closed surgery is preferred, reducing inflammation before surgical procedures, and for patients who are contraindicated for extensive surgery due to systemic health issues. Additionally, Curettage is valuable in maintenance and recall therapy for managing recurrent inflammation. These indications guide clinicians in selecting the most appropriate treatment for each patient. While gingival curettage is beneficial in many cases, it is contraindicated for patients with extensive systemic issues or those unable to tolerate surgery. It's important for clinicians to assess each patient's overall health and risk factors before recommending curettage. Proper patient selection ensures safety and maximizes the likelihood of successful outcomes. The basic technique for gingival curettage begins with local anesthesia to ensure patient comfort. Using a curette, horizontal strokes are applied to engage the inner lining of the gingiva. External finger pressure may be used to support the tissue during the procedure. For subgingival curettage, a scooping motion is performed from the pocket bottom toward the alveolar crest, effectively removing diseased tissue. These steps are fundamental for achieving optimal results. The excisional new attachment procedure, or ENAP, is a specialized technique that involves an internal bevel incision. This approach preserves interdental tissue and is followed by root planning and tissue approximation. ENAP is designed to promote new attachment of the gingiva to the tooth, enhancing periodontal health and stability. It is particularly useful in cases where traditional curettage may not be sufficient. Alternative modalities for gingival curettage include ultrasonic, chemical, and laser techniques. Ultrasonic curettage uses vibrations to disrupt tissue and alter fibroblast nuclei. Chemical curettage employs caustic drugs like phenol, which can be difficult to control and may cause extensive tissue destruction. Laser curettage offers bactericidal and detoxification properties, making it ideal for treating inaccessible pockets. Each modality has specific benefits and risks, and selection depends on clinical circumstances. Healing after gingival curettage is rapid, with granulation tissue proliferating and sulcular restoration occurring within 2 to 7 days. Immediately after the procedure, the area appears hemorrhagic and bright red. By 1 week, the gingiva shows reduced height, an apical shift, and less redness. After 2 weeks, with proper oral hygiene, the tissue returns to a normal appearance. Understanding this timeline helps clinicians and patients anticipate recovery and monitor progress. In summary, gingival curettage is a valuable periodontal procedure for removing diseased tissue, resolving inflammation, and promoting healing. It is indicated for various clinical scenarios and can be performed using different techniques and modalities. Proper patient selection, technique, and post-procedural care are essential for optimal outcomes. By understanding the principles and steps of curettage, clinicians can enhance periodontal health and patient satisfaction.